I want you to do something before this video reaches 1 minute. Walk to the nearest mirror, open your mouth, and stick out your tongue. Look at it carefully, not a glance. A real look at the color, the texture, the coating if there is one, the edges, the center, the tip. What you are looking at is not simply a muscle you use to taste and swallow. You are looking at one of the most information-dense diagnostic surfaces on your body, a living readout of what is happening inside your organs right now, in real time, that has been used in clinical medicine for thousands of years, and that modern research is continuously validating. And the color you see matters more than almost anything else you could observe in a 30-second self-examination. I am Dr. David Miller. I have been practicing medicine for 15 years, and I built this channel on a single principle. The information that can help you catch something early before it becomes serious belongs in your hands, not locked behind appointment wait times and 12-minute consultations. Subscribe to Dr. Miller right now and hit that like button. We are working toward a community of people who use their own bodies as the diagnostic instruments they actually are. Every subscriber makes this channel more visible to the next person who needs it. Before I walk you through the 6 colors, I need to explain why the tongue carries this information at all, because understanding the mechanism is what makes the observation meaningful rather than merely alarming. The tongue is one of the most vascularized structures in the human body. It is threaded throughout with a dense network of capillaries, the finest branches of the circulatory system, that sit very close to the surface of the mucosa, the thin, moist lining you see when you look in the mirror. This proximity means that changes in the composition and oxygenation of the blood, changes in circulation, changes in the metabolic state of the body, and changes in the balance of the digestive and immune systems all produce visible changes in the color, texture, and coating of the tongue. The tongue is not producing these signals intentionally. It is simply reflecting the systemic state of the body through tissue that is thin enough and well supplied enough to make those reflections visible. Think of it as a window, not into a single organ, but into the integrated function of your circulatory, digestive, immune, and metabolic systems simultaneously. The tongue also has a coating, a thin layer of material produced by the interaction of bacteria, shed cells, and immune activity on the tongue surface. In a healthy person, this coating is thin, white, or very slightly yellowish, and distributed evenly. Deviations from this baseline, in thickness, color, distribution, and texture, carry their own information about digestive function and immune activity. I will address the coating alongside the color in each of the 6 findings I want to describe. Let me also say clearly before we begin that nothing I describe in this video replaces a clinical examination. What I am giving you is a framework for observation, a way of recognizing patterns that warrant investigation, not a system for self-diagnosis. The purpose is to give you better questions to bring to your physician, not to replace the physician. The first color is pale. A tongue that is visibly lighter than the normal pink, that appears almost white or washed out across its surface, is one of the most consistent and clinically reliable signals of anemia, specifically iron deficiency anemia or anemia related to B12 insufficiency. The mechanism is straightforward. The pink color of a healthy tongue comes from the hemoglobin in the capillary blood showing through the thin mucosa. Hemoglobin is the iron-containing protein in red blood cells that carries oxygen and gives blood its red color. When hemoglobin levels fall, either because there is not enough iron to produce adequate hemoglobin or because B12 deficiency is impairing red blood cell production, the blood becomes less red and the tongue becomes less pink. The capillaries are still there. There is simply less color in the blood flowing through them. In clinical practice, I look for pallor not only on the tongue surface, but on the underside of the tongue, where the mucosa is thinner and the capillary bed is more directly visible. Significant pallor in both locations in a person who is also experiencing fatigue disproportionate to their activity level, shortness of breath on mild exertion, or a persistent sense of coldness in the hands and feet is a pattern that warrants a full blood count and iron studies without delay. This is not a complex investigation. It is a standard blood panel. but it is one that many people defer for months or years because the individual symptoms seem explainable by other things. Pallor of the tongue is the integrating signal that says these symptoms belong together and they have a common cause worth finding. The pale tongue often comes with a thin, watery coating or almost no coating at all. This is consistent with the depleted nutritional state that underlies iron and B12 deficiency. The body is not producing robust immune activity at the mucosal surface, and the coating reflects that quiet, depleted state. The second color is deep red or crimson, a tongue that is noticeably darker and more intensely colored than the normal pink, sometimes with a slightly shiny surface as though the mucosa is stretched. This finding points in a different direction from pallor. A deep red tongue indicates a state of heat and inflammation in the body, in the clinical language of integrative medicine, or more specifically in modern terms, a state of elevated systemic inflammatory signaling combined with possible dehydration of the mucosa. The most common causes I encounter clinically are active infection, particularly bacterial infections that are generating a significant immune response, a state of chronic systemic inflammation driven by diet and metabolic factors, and in some cases, early liver dysfunction, where the organ's ability to clear inflammatory compounds from the circulation is compromised. A deep red tongue with a dry surface and no coating is a particularly significant finding. The absence of coating on an intensely red tongue suggests that the mucosal surface is inflamed enough that normal coating formation is disrupted and that the body's fluid balance is compromised. If this is accompanied by a dry mouth that persists despite adequate fluid intake, by a persistent bitter or metallic taste, or by consistently dark urine, these findings together paint a picture of significant internal heat and inflammatory burden that deserves investigation, including liver function tests and inflammatory markers. A deep red tip specifically, where the body of the tongue may be more normal in color but the tip is distinctly redder and sometimes slightly raised, is a finding I associate with cardiovascular stress and autonomic nervous system overactivation. The tip of the tongue in traditional diagnostic systems corresponds to the heart and upper thoracic circulation, and while the mapping is not mechanistically precise in the way modern anatomy is, the clinical observation is consistent. People who are under significant chronic stress, who have elevated resting heart rates, who are sleeping poorly, and who are experiencing anxiety at a level that is affecting their physiology, often show this specific pattern of tip redness. The body is broadcasting its stress state through one of its most accessible surfaces. Subscribe to Dr. Miller and hit the like button. What I am describing, reading the tongue as a clinical instrument alongside standard examination findings, is a practice that integrates traditional diagnostic wisdom with modern understanding of mucosal physiology and systemic inflammation. It does not replace laboratory testing. It gives you a reason to request it. This channel exists to bridge that gap between observation and action. Hit subscribe. Every subscriber means the next person with this question finds real information. The third color is purple or bluish, and this is the finding that I want you to take most seriously if you see it in your own reflection. A tongue that has a distinctly purplish or bluish hue, either across its entire surface or concentrated on the underside where the veins are visible, is a signal of impaired circulation and reduced tissue oxygenation. The mechanism is the same one that produces blue lips and blue fingernails in states of cardiovascular or respiratory compromise. When blood oxygen saturation falls, or when venous blood is not being returned efficiently from the peripheral circulation, the deoxygenated hemoglobin produces a bluish-purple tone in the tissue. On the underside of the tongue, two veins run parallel from the tip toward the base. In a healthy person, these are faintly blue but not prominent. When these veins are visibly distended, dark, or tortuous, taking on a cord-like appearance, this is a finding called sublingual varicosity. It correlates with venous stasis, the pooling and slowing of venous blood return, and in research literature it has been associated with cardiovascular disease, hypertension, and in older populations, with elevated cardiovascular risk. This is not a diagnostic finding on its own. But if you lift your tongue and see veins that are prominently dark and visibly distended, and you have not had a comprehensive cardiovascular assessment recently, this finding is a reasonable prompt to seek one. A generalized purplish hue across the tongue body in a person who is also experiencing shortness of breath, unexplained fatigue, or swelling in the legs and ankles is a more urgent finding. The combination suggests that the cardiovascular or respiratory system is not maintaining adequate tissue oxygenation, and this warrants prompt medical evaluation rather than watchful waiting. The fourth color is yellow, specifically a yellowish coating on the tongue surface ranging from pale lemon to deep mustard in more severe cases. This finding is almost universally a digestive signal. A thin yellow coating on the tongue represents a disruption in the upper digestive process, most commonly related to excess acid production in the stomach, sluggish gallbladder function, or a dietary pattern high in processed and fried foods that is generating excess digestive heat and bile reflux. A thick, greasy yellow coating is a more significant finding that points to a more established state of digestive dysfunction, often involving the liver and gallbladder, and in some cases, the pancreas. The tongue coating is produced at the mucosal surface by a combination of bacteria, shed epithelial cells, and secretions from the immune tissue of the tongue. When the digestive system is functioning normally and efficiently, this coating is thin, white, and even. When the digestive process is generating excess waste products, when bile is refluxing into the stomach, or when the liver is producing an excess of certain metabolic byproducts, these compounds reach the tongue surface through both direct contact with refluxed material and through the bloodstream, and the coating changes in color and thickness accordingly. Clinically, I find that people with a consistently thick yellow coating often report symptoms of heartburn or acid reflux, a bitter taste in the morning before eating, discomfort in the right upper abdomen after fatty meals, and sometimes a persistent sense of nausea or heaviness after eating. These symptoms, together with a thick yellow coating, form a pattern that warrants investigation of gallbladder function, liver enzymes, and gastric acid regulation. People who have been managing these symptoms with acid suppressors for years without investigating the underlying cause of the excess acid production will often have a tongue that has been trying to communicate this picture for the entire duration of their treatment. The fifth color is geographic tongue, which is not a single color but a pattern, and I include it here because it produces a distinctive coloration that many people notice and many people misinterpret. Geographic tongue appears as irregular patches of smooth, bright red or pink mucosa surrounded by slightly raised whitish borders, creating a map-like appearance across the tongue surface. The smooth patches represent areas where the normal small projections on the tongue surface called filiform papillae have been shed, leaving the underlying mucosa exposed and more intensely colored. The pattern shifts over days to weeks, which is why it is described as migratory. Geographic tongue is benign in most cases and does not itself require treatment, but its presence is a consistent marker of an immune system that is hyperreactive, a body that is prone to inflammatory responses at mucosal surfaces. In clinical practice, I see it most frequently in people with food sensitivities, particularly to gluten and certain food additives, in people with systemic autoimmune tendencies, and in people under significant psychological stress. It is the immune system manifesting its reactivity at the most accessible mucosal surface in the body. When I see geographic tongue in a patient who is also reporting joint pain, skin issues, fatigue, or digestive irregularity, I treat it as a prompt to investigate systemic immune dysregulation more carefully rather than simply reassuring them that their tongue is harmless. The sixth color is a black or very dark brown coating, and I want to be clear that this is the finding that most people who encounter it find alarming, and in most cases the cause is far more benign than the appearance suggests, but the investigation still matters. A dark brown or black, hairy-appearing coating on the tongue is almost always the result of an overgrowth of the normal bacteria on the tongue surface combined with a staining of the elongated papillae by pigmented compounds. The most common causes are recent antibiotic use, which disrupts the normal bacterial balance of the mouth and allows certain species to proliferate unchecked, tobacco use, heavy coffee or black tea consumption, and the use of bismuth-containing compounds such as certain antacids. The reason I include it in this list, despite its usually benign cause, is that a black tongue coating that appears without any of these obvious explanations in a person who has not taken antibiotics recently, does not smoke, and does not consume large amounts of coffee or tea is a finding that warrants investigation. Severe systemic illness, significant immune compromise, and in rare cases certain medication reactions can produce this appearance. If you see a dark coating on your tongue and cannot explain it with the common benign causes, it belongs in the category of things to show your physician rather than observe and wait. Now, I want to give you a simple weekly practice that costs nothing and takes less than 60 seconds because the value of everything I have described depends entirely on whether you look consistently enough to notice change over time. Once a week, ideally on the same morning each week before you eat, drink, or brush your teeth, go to a mirror in good natural light and look at your tongue with genuine attention. Stick it out fully and look at the overall color first. Then look at the coating, its thickness, its color, its distribution. Then lift your tongue and look at the underside, at the veins, and at the mucosa. Finally, look at the edges and the tip. Take a photograph on your phone once a month and save it. In 6 months, you have a visual record that can show a physician whether a finding has been present for a long time or appeared recently, which changes its clinical significance entirely. The specific things that should prompt you to seek evaluation rather than continued observation are these: a pale tongue accompanied by fatigue and breathlessness, a deep purple or bluish hue particularly on the underside with prominent distended veins, a very thick yellow or brown coating that persists for more than 2 weeks, a deep red dry tongue accompanied by dark urine and persistent bitter taste, geographic tongue in the presence of multiple other symptoms suggesting systemic immune reactivity, and any dark coating without an obvious benign explanation. These are not emergency findings in most cases. They are investigation prompts. They are your body's way of asking you to look more carefully at what is happening inside it. How old are you? Write it in the comments right now. I want to know the age distribution of this audience because it directly shapes what I cover next. If the majority of you are in your 60s, I want to go deeper on the circulatory findings, the purple and pale findings that become more clinically significant as the cardiovascular system ages. If many of you are in your 70s, I want to address what the tongue can show about kidney function specifically, a connection that is well documented and almost never discussed outside of specialist practice. The tongue has been used as a diagnostic tool for longer than laboratory medicine has existed, not because ancient physicians were guessing, but because they were observing carefully enough to notice that the tongue reflects the body's internal state in ways that are consistent, reproducible, and clinically meaningful. Modern research is progressively confirming what careful observers have noted for centuries. You have had access to this diagnostic instrument your entire life. It is in your mirror. It requires no appointment, no cost, and no prescription. All it requires is that you look. I am Dr. David Miller, and I have spent 15 years watching patients walk into appointments carrying information on their tongue that would have directed their workup more efficiently if anyone had thought to look. The tongue is not the whole story, but it is a remarkably consistent chapter. Subscribe to Dr. Miller. Hit the like button. Share this with someone who has been feeling that something is off in their body and cannot explain it. Their tongue may already be showing them where to look. The healthcare system generates revenue from tests ordered after symptoms become serious. I generate this channel so you can recognize the signal before it gets to that point. Subscribe if that difference matters to you. This content is educational in nature and does not constitute personalized medical advice. If you notice persistent changes in your tongue color or coating, please speak with your physician about appropriate evaluation. The findings discussed here are observation prompts, not diagnoses, and should be interpreted by a qualified healthcare provider who knows your individual medical history.